Okay. So what we're going to do then is recap on what we've gone through this morning. Just recap on some of the practical parts of a positive approach to care and hand under hand. So we talked about distance. Bless you, Julia. We talked about distance. I was really catching. We talked about distance. What's important about the distance? So if we imagine we've got our patient sat in front of us, why do we need to stop and engage with the person before we start doing anything or doing any kind of activity with that person? Can you remember what we talked about?
So that they're aware that the song's about to approach them.
Yeah.
And the vision as well.
Yeah. So we said about vision. We talked about personal space. We talked about intimate space and not having anybody getting into your intimate space before you'd engage with them. Why do you think that is? When we touched on it this morning, if somebody was in your intimate space before you've engaged with them, how does that make you feel? Yeah, frightened, maybe a bit agitated. And what sorts of reactions might you then see? If you're thinking about a person that's living with dementia, if you get in somebody's space, they then feel scared and frightened, what sort of behaviour might that person display?
Physical behaviour.
Yeah. So they might maybe start grabbing at you or shouting or, I don't know, getting distressed in some way. So obviously it's just important for us to remember the importance of distance and space, the speed of how we approach the individual, stopping at the edge of what we call public space. Can you remember how far away that was? 6 foot? Yeah. And then intimate space is about arm's length around the individual. Okay. So we talked about visual changes, loss of perception, peripheral vision, depth of perception, changing for that person as well. So we stand up. We imagine our patient is here. We would walk in slow. It feels uncomfortably slow. We would stop at the edge of that personal space. We would say hello or greet the person. So it might be, hello, how are you? I'm Sharon. And then move in towards their more intimate space. And then go into hand under hand. Okay? So if I just, Simran, do you mind if I practice on you? Is that okay? Are you all right there?
Yeah.
So.
Just stay silent.
Yeah, pop that. That's probably not the best, is it? So it would be, hello, Simran. Hello, how are you?
Good, thank you.
Good. Has it been a good day?
Yeah.
Enjoying it? Yeah. So quite a natural, and you can do whatever you want in the way that you, what you say, but just remember, slow movement, pausing, engaging. We said about the hand to face, so it's about that visual connection with the person. Then stretching out arm to go into a handshake. We've got that connection, and then we move to hand under hand. So your hand is underneath. And the idea in a minute will be that you'll practice this with one another, okay? But remember what I said about standing side on? Can you remember why I said don't stand over the person? How do you feel now? But it is intimidating, because to be honest, it feels uncomfortable for me to be standing over somebody, but for you, not a nice feeling. So stand side on, and if you can, get down low, because that's not as threatening. Okay. So the idea now will be that you'll practice that with one another. Before we do that, what would be good, although we went through the visual, the scuba mask, didn't we? We went through binoculars, we went through monocular vision this morning, but it might just be good if one of you is actually the patient and will apply your mask and you have and you approach one another, and then switch it over and see how it feels. Does that sound okay? Are you happy to give that a go now? Yeah. So I don't know who wants to go. Who wants to be patient? Who wants to be nurse first?
Be the nurse.
See, Julie's comfortable in that chair. But just remember, Julie, as the patient, for you, I mean, I don't know, you might just want to manoeuvre a bit of furniture. You might, I don't know whether, do you want to bring your chair round to here, maybe?
That chair?
Yeah. If you're the patient and you're sitting here, and then at least Simran can walk in.
Okay.
And for you, just apply your scuba mask to start with, and just to see how it feels. So you can try walking in quickly first,
Okay.
and then walking slowly. Okay, and we'll see how it feels for Julie.
Okay. Hello, Julie. Hello. How are you? I'm alright. How's your day been? Oh yeah. No way.
Yeah. But I tell you what though, when you just try, you see, Hannah, try the approach again. Because you just tell me, what did you did that? How did it feel? I suppose for Julie, how did that feel? It felt okay.
Yeah.
Did it feel slow? Yeah. Yeah.
Shall I do it slowly? Hello, Julie. Hello. How are you today? I'm alright. And you? I'm good. What have you been doing today? Nothing.
Okay. So, Julie, how did it feel with your mask?
Just
Felt okay? Didn't feel
no.
pace? Felt good?
Also good.
Yeah.
Yeah.
What about yourself, Simran? How did it feel?
A bit slow.
Slow.
Yeah.
But you know, I bet out there in practice you guys are rushing around, aren't you?
Yeah.
So you probably wouldn't have been, because it didn't seem overly slow. I think when I that does feel very slow to me.
Yeah.
But it looked quite paced. What I would say is, when you get so far, then stop.
Okay.
Okay? Then it's hello and engagement, and then move in. And then with the hand under hand, you're just switching it over like that. And the more you practice it, the more natural it's going to start to feel. Okay? Do you want to switch over? Yeah? And you can have a little go. So you're going to have a scuba mask, or you're going to have binoculars, or? Okay.
Hello, Simran. Hello. How are you? I'm okay, thank you. How are you feeling today? Not bad. Not bad. How was that?
How did it feel for you, Simran, as a patient?
Not bad. Okay.
Okay, so pace felt okay.
Yeah.
So you felt quite comfortable.
Yeah.
What about yourself, Julie? How did you feel? I know it's a bit self-conscious, isn't it? And I'm sure when you're out there in practice, you're not going to be be thinking about this as much as what we are doing now. What I would say, how did it feel for you first?
Okay.
Okay. Yeah. What I noticed was, as you walked, you waved. Okay, don't wave, just hand. Okay, it's hard not to do it because you naturally want to wave, but it's more of a fixed motion. So it's hand up to the face, okay? Then move into hand under hand, and I noticed your hand stayed on the top. But it's because you went to like a handshake, which was lovely, but then your hand stayed on the top. Okay? So have another little go and see how you feel.
Hello, Simran. Hello. How are you today? I'm good, thank you. How are you? I'm alright.
Okay, my lovelies. Well done.
I'm good.
So I can see that time.
Yeah.
Just from feedback, it was nice and paced. You stopped, you raised your hand. Obviously, I know for us, as we're practicing, we're engaging, aren't we? But we've got to remember that the people that we're working with may not be looking at you.
Yeah.
So it's going to be a little bit harder than just go, oh, hello, walk in. You know, you're going to have to be looking down, trying to engage. before you can then move in. But you stood to the side, you weren't standing over, which was good. You were lovely and, I mean, both of you were smiling, lovely and friendly and you know, had connected with that, the symbol. So connected with your patient, okay?
I still don't understand, what difference does it make to do that, to this?
Yeah, so the difference that it would make is, if you remember what we said earlier on today, we said about people not being able to understand language, so they're not processing what we're saying to them. So we just go, hello Simba, walk in, shake hands and carry on. We're going to give you a wash now and start doing things. But actually that person doesn't understand what's happening. But by us having that positive engagement, makes them feel a little bit more calm, a little bit more relaxed. They've got that connection with us. So we're still probably going to go on to do the same things, but it's about engaging first. Then when we move into hand under hand, you can use that hand then to do certain things. So if you imagine when it comes to eating, so often it would be, feels quite natural when we're feeding ourselves. It feels very uncomfortable if somebody else is feeding you. But you can use hand under hand to, as part of feeding, as part of personal care, as part of having a drink. And in a second you're going to have a go at doing that. You're going to practice that on one another just to see how it feels, okay? I think you probably do, all of the things we're saying are probably not new to you, I don't think, because we would encourage you throughout your nurse training to say hello, to look engaging, to communicate with the person. But the difference now, what we're thinking is, for the person that's living with dementia, not all people are going to fully understand language and process what you're doing. And it's about connecting with them first before you go on to do whatever. Okay? Yeah? So the next bit now is just to practice having a drink. Okay? So,
Oh, we're doing it here.
yes. So it's to practice having a drink using hand under hand. Okay? So again, if I just demonstrate for you, do you mind if I turn the camera around a little? Okay, so the idea with hand under hand, so this will be your cup of water. So if you imagine now, okay, so I've walked in, we've done hello, hello, how are you? And you're walking in to hand under hand. How have you been today?
Good.
Good. Now, ideally, it would be good if we got a chair nearby. So what we could do then is move in and sit with you in hand under hand like this, okay? So it's been okay today. Remember I said about earlier on applying a little bit of pressure over a joint? Proprioception, so you could do it here, or you could do elbow, whatever feels comfortable. So, you've had a good morning? Yeah, you've enjoyed it? Okay. Do you feel like you fancy a drink?
Yeah, I haven't had a drink in a while.
Okay. So what you can do, and you're being a lovely patient, and you're being lovely and engaging, we do say, people that are living with dementia, obviously, not to give them too many options. They may not engage directly like you've done, so it may just be a little bit more of, do you fancy a drink? And pointing and showing.
Okay.
So then there's that reinforcement with what you're saying and what you're pointing and showing.
Okay.
Okay? So, do you fancy a drink?
Yes.
Yeah? Okay. And then what we can do is, I could use, if we imagine, it's here, hand under hand. I hold the drink, but it's your hand. I would apply pressure over a joint. It's I was going to say, did you get a little drink then? You know, I didn't want to give you too much in case you laughed and then choked on it. Okay.
Like, would that be like a risk of the falling?
Could be. There is potential, I suppose. All you've got to think here, I mean, I've filled this up quite a lot. I got carried away in the water machine. But you've got to think often, we do have a range of different feeding devices, drinking
yeah, that's
devices,
true.
don't we?
Yeah.
So it may not be an open cup that we've got
Mhm.
here, for example. I think we'd have to think about risks, wouldn't we? We mentioned
Yeah.
that this morning. But you're thinking about, I don't know, I'll tell you what would be a good comparison, okay? So if you imagine, in a normal care setting, you would see people giving somebody a drink often. So it would be, no, my daughter say things, do you fancy a drink? Or point to a drink, and you might go, oh, yeah. So now, if I do it, I'll just give you a drink, okay? You know, don't choke on it. Okay. And then I've got to do it that way actually. I'd have my table here. We're in hand under hands. And then it's your hand. Does it feel better or not?
Yeah, I think
Do you
it is.
think?
Yeah. I feel like I prefer it, you say,
Yeah.
rather than,
Then somebody.
yeah.
The idea is that it's stimulating nerve pathways, and then it's reconnecting with some of those memories about having a drink. So it's sort of reconnecting some of that behaviour from there before, so it feels more comfortable. Yeah. So that's- Yeah. I think the idea is with this is that you can use this technique to help somebody brush their teeth, help them have a wash. You'd still be doing personal care, but
For the person, it'll be like they're doing
it feels like they're doing it.
Yeah.
Yeah, so you're still doing all those things, and the person, it often can feel less intimidating, that it's them that's doing it rather than us doing it. So that's the idea behind hand under hand. But it's one of those techniques that when you move in, you're not, because there is, people have said about the manual handling risk. So you would be using this technique, obviously as we've said, feeding, personal care. If the person was confused, disorientated, aggressive, then you wouldn't be using this technique because there is some kind of unmet need that we'd need to resolve first, wouldn't we? You wouldn't come in and think, if somebody was really agitated and then you start saying, let's give you a wash, do you know what I mean? That's
Yeah.
not going to help, is